Do you have back pain, and have you had imaging such as X-ray, MRI, or CT scan and been told that you have spondylolysis? Do you wonder what that means and what that looks like? Don't worry, you're not alone. Hi, I'm a chiropractor. My name is Dr. Matthew Collins. I'm board certified in rehabilitation and I'm fellowship trained in primary spine care. And we have been helping patients that have had the diagnosis of spondylolysis for many, many years. Please remember, these videos are for informational and educational purposes only. They are not a substitute for chiropractic or medical advice, for diagnosis, or for treatment. So let's get started. So this right here is a sample piece, replica of the lower back. All right, in here you have these bones right through here. These are the bumps that you would feel on the back of your neck. These right here are the joints. These right here are the discs, right here, and these are the vertebral bones. What can end up happening is that you can have a fracture through the backside of these vertebrae here. And that fracture leads to what's called a lysis, which means a gap. That break right there can create a lot of problems. So how does it give you pain? Well, obviously, if it just happened, you're going to have what's called acute pain from the initial fracture, basically a broken bone in the back. So what can do that? Well, in children, we see this happen if they're athletes, if they do repetitive motions such as gymnastics, if they play football or hockey and they have a hard blow to their back, that can create a fracture. It can happen later in life too, from really traumatic events such as falling and hitting your back. It can happen in motor vehicle crashes, though not as commonly. But anything that's traumatic that exceeds the strength of the bone, fracture that. So you can have the initial acute pain. Many times, however, these are stable, meaning like they do not need to be surgically repaired right away, and many patients just go on to live their life. Some patients have fractures happen, don't even really know it, usually earlier in life, and then later in life it's discovered, and it's discovered to be chronic. So with the chronic patients, where does the pain come from? Well, sometimes the actual crack itself is still painful. The bones can be loose. So that's called the biomechanics. So biomechanics basically means that the spine is like an engineering system. It's supposed to be stable. It's supposed to hold you upright against gravity, be able to bend, rotate, twist without any pain or problems. So if you have a break in the underlying foundation, that break can cause a weakness and will create symptoms. Additionally, sometimes the break will create loosening of the joints where they'll slide back and forth. So if it's really loose, it can slide out of position and out of alignment. That right there can create problems when you go to bend, lift, or twist. Also, sometimes it can slide and then jam and lock in a certain position. That restriction also can create problems. Once again, when you bend and lift, there has to be movement, there has to be some pliability within the system. And spinal biomechanics are no longer pliable. They're no longer able to respond to input, output. Once again, pain, restricted motion, and basically difficulty doing activities of daily living. So treatment-wise, can chiropractic care help? Absolutely. Now, not in every case. That's why you need a diagnosis. That's why you need an exam. And taking a look at your imaging, a chiropractor can tell you what can be expected and what may not be expected. So if you've been diagnosed with spondylolysis and wondering if chiropractic care can help you, we invite you to come in, have an exam, we'll look at your imaging, put together a treatment plan, and we'll let you know if we are able to help you or not. You have a lot of videos that you can pick from. I'm honored that you chose this one. And until we meet again, be blessed.